Hi guys, my name is Celine Fan and my presentation is about the staffing of nurses in U.S. hospitals. What you guys will learn from my presentation is the problems associated with staffing of nurses and why there are still shortages of nurses throughout hospitals in the United States. Additionally, we will discuss the solutions that were applied to this problem and whether it had any effect. As well as explaining the cause and effect of nursing shortages, this presentation will also look into how it affects the way patient care is delivered. First and foremost, how and why are nurses important in the healthcare industry, and what is their role? Nurses play a very important role in the healthcare industry, and it also makes up the largest group of licensed healthcare professionals in the U.S. With this much pressure on nurses every day to provide the utmost quality care, there are often a number of nurses that feels burnt out and stressed from the workload and pressure. Their task consists of regularly monitoring and assessing their patients, coordination of care delivered by other providers, and informing patients and family members for discharge. Nurses develop substantial knowledge of the strengths and weaknesses of the hospital systems and how they fail, because they're always there and they know the operations of the hospital inside and out. Therefore, their perspectives are vital and must be represented during hospital decision making. Next, I will go into some of the challenges associated with the staffing of nurses. As a result of an aging population, the rising incidence of chronic disease, and an aging nursing workforce, the demand for nurses are constantly increasing. Although the occupation for nurses is on the rise, the demand is still outpacing the supply. U.S. hospitals have experienced shortages in nurses for many years, but it is only getting worse due to the high demand. The main cause of the increased demand for nurses is because Americans' life expectancies has increased. As life expectancy increases, chronic illness also increases because older adults are prone to having at least one chronic condition due to poor immune system. The staffing of nurses in the U.S. hospitals is one of the main problems in healthcare. Insufficient numbers of nurses staff in a hospital could alter the way patient care is delivered and also is very dangerous. With increased amount of workload due to shortages of nurses in a hospital, nurses will feel burned out as mentioned earlier and won't perform at optimal level. As a result, it could potentially increase the number of medical errors and patient deaths. Some solutions that have been implemented to resolve the shortages of nurses are the hiring of travel nurses, which is a nurse that is hired to work in a specific location for a typically 13 weeks period and move around the country depending where they are needed. Another strategy that has been applied was giving incentives for nurses to work longer hours. This solution, I believe, would actually lead to nurses becoming more burned out from working such long hours. These solutions will only provide a temporary fix. Some hospitals are looking at longer term solutions, such as robotic nurses or widening the path to a degree for aspiring nurses. Although the use of robotic nurses can improve the shortages of nurses or even end the shortage, it can have many defects as well because robots won't know their patients' actual feelings, and it could also have technical difficulties, which could result in medical errors or lawsuits. As for widening the path to degree for aspiring nurses, I believe it is a great solution and a step to end the shortage of nurses in U.S. hospitals because it will give them more opportunities to pursue a higher education in that field. In conclusion, the shortages of nurses in hospitals in the U.S. is still a rising problem, even with the solutions implemented. What I would suggest is that hospitals should look into more long-term solutions instead of short-term. This issue should be paid more attention to because with the population growth and life expectancy increasing, nurses are continuing to be in high demand. That concludes my presentation. Thank you.